Some governments do things well at certain times. It's very difficult to generalize. For example, I was talking recently, and I wrote about this with a remarkable economist called Robert Frank at Cornell University. And Frank says, well, when I go to France, it's marvelous because when I'm ill, I can go to any medical doctor and it's practically free. And it's wonderful. We need that in the United States. What Bob Frank forgets is that I paid for him being cured by a French doctor. What I mean by that is that these kind of choices are always trade-offs. There is no perfect solution. I would consider that the French healthcare system is better than the US diversity of healthcare systems. But we pay a very heavy price for it in terms of taxes and unemployment. The healthcare system in France, as you know, is paid by the employers and the employees, which means that when you recruit an employee, you have to add approximately 60% on top of his salary, 60. 10 is paid by the employee himself and 50 by the employer, 60%. To finance our social security system. So as a consequence, it's very difficult to recruit people because the wages are very high. And so the rate of unemployment is also very high. So it's a trade-off between the job market and the healthcare system. You have to make this kind of choice. You can't have the best of both. You have to choose, and I think you have to make the choice very clear. And you also have to take into account the history of each nation. I always say in France that I like the US free market system. I don't advocate a transfer of the US free market system in France. It wouldn't work. It's not our culture. I wouldn't advocate a transfer of the French or the British system in the United States. I think it wouldn't work also for cultural reasons. So it's always a trade-off between what you gain, what you lose, and taking into consideration the local traditions.